labor, during one and descend, sometimes the head of the baby will now pass, and the moment the head of the baby pass, the placenta can follow, no problem. But if the placenta is already covering the cervix, then there's nothing you will do apart from to bring the baby through another road. Since the placenta has already blocked the road through the cervix, we will now do CS and deliver the baby through another route. That is just placenta previa. Sometimes it's an indication for surgery. Okay? Now, something happens. What she's now asking is, there is nothing known to cause it. That's just that the baby decided to implant in the wrong place. I don't know if you understand. Some people will say, stay like this, it will not cause it. Some people will say, stay like this, it will not cause it. But there's another thing that has to do with placenta previa. It is not a final sentence. You might have a placenta previa at 5 months gestation or 4 months gestation. By the time the baby is term, the placenta will go up on its own. Just the same way the baby might bridge at 5 months or 6 months, very close to the time of delivery, you see that the baby has turned. Sometimes placenta previa, especially type 1 or so, or type 2, can actually ascend as the pregnancy is progressing. So sometimes when the baby is trying to turn, then the placenta ascends with the baby. So that somebody has a placenta previa at 5 months or 6 months doesn't mean that you must operate on that person. Sometimes grade 3 can degrade to grade 2. Grade 2 can go to grade 1. And grade 1 can go to the fact that there is no placenta previa at all. And somebody who doesn't have placenta previa at 7 months can equally have placenta previa at 9 months. So the placenta can actually ascend, it can actually descend. Is it clear? So, and the other thing we talked about is placenta abruptio. That is a brother to placenta previa, because 2 of them can give us bleeding. But as we said in the other video, how you distinguish the 2 in clinical practice is a placenta abruptio will come with severe pain, right? Placenta previa doesn't come with pain. You just see that there is bleeding. But abruptio will give you severe pain. In fact, sometimes by the time you look at the tummy of a woman that has placenta abruptio, you have known. The tummy will have what we call pod-like rigidity. It will just be so strong that the woman will interpret it as continuous contraction. Contraction gives pain. Placenta abruptio equally gives pain. But how you distinguish normal contraction from placenta abruptio is that in normal contraction, the pain will come, then allow that woman to rest. I don't know if you understand. Let the contracting uterus breathe. It will contract and allow the uterus to breathe. It will contract and allow the uterus to breathe. But in placenta abruptio, the contraction continues without giving way for the uterus to breathe. Is it clear? So in that way, but in placenta previa, the pain is not much, apart from the pain of normal contraction. But 2 of them will usually have bleeding. And 2 of them can threaten the life of the baby. But abruptio kills the baby faster. In fact, in most cases, before you get abruptio, the baby has died. Unless it's partial abruptio. She's asking if carrying weight can cause placenta previa. No. Placenta previa, as I said, have no cause. Then placenta abruptio, sometimes there might be some trauma in the abdomen, but the trauma has to be so severe to be able to dislodge the placenta. But if that placenta is attached to the uterus, before the trauma can dislodge it or get taken,